Okay. Preparing live stream, preparing to stream the meeting.
Yeah, we are live.
You're live.
Okay. Hello and welcome to this amazing session where we are capturing the COVID updates from India. And we all know that the COVID-19 situation is in a crisis and India is in a national emergency. We have with us today Dr. Priyanjali Datta from Aaroogya Foundation and Dr. Dhruv Kacker, who is also a partner in Aaroogya Foundation. So Priyanjali Datta is a very, very accomplished a healthcare professional. She has been a great initiator of breast cancer supporter for the underprivileged. She has brought in a lot of initiatives like telehealth, modern technologies, and spreading awareness about breast cancer, and several other initiatives to the underprivileged sections. And she's also been recognized with top honors as top 50 global healthcare leader, and she's also co-founder of Pinga Healthcare, and her accolades run long. So do Dr. Dhruv Kacker here. He's from Johns Hopkins, and he brings in a wealth of knowledge and expertise to this discussion today. And I just hand over the stage here today to Dr. Dhruv Kacker, and I want to find out from him what is happening today in the front lines. What's going on in India in the COVID-19 situation? You're based in Delhi, and you are handling a consortium of top-notch, corporate and government and non-profit organizations. What's happening with the COVID situation in India? So a general overview, and then let's get into the specifics.
Uh, I'll start with it. So this the so-called national emergency, it actually came upon us very, very quickly, and everything was seemingly fine till about 15 days back. And in just 15 days, the cases just started. They just rose from absolutely nothing to 300,000 as of what they are standing today. And because this happened, that there are multifactorial reasons for it. Laxity on the part of our political leaders, laxity on the part of the general public, and and the third thing and the most important thing is the classic case of self-denial, that we have been in case of in self-denial that this will not happen and this will not happen to us, and it has happened to everybody at once. Unfortunately, the infrastructure of Delhi, which is one of the best in the country, the healthcare infrastructure has collapsed, because it's just not, because world over healthcare infrastructure is made with with the fact that a percentage of population can be treated at once, like 2% or 3%, or max to max 5%. But what about when you have 33% of your state or a city falling ill at once? We are having that sort of situation. We are running out of oxygen cylinders. We are running out of resources. We are running out of beds. We have ran out of virtually each and everything in last 10 days. And trust me, the worst is yet to hit us, and things are just going to get worse and worse and worse from here on. I don't know where to start and where to finish it off, but this is the gist of what has happened to India in last 10 to 15 years.
Okay, so Dr. Dhruv, that is heartening. It's a very sad situation to say. I hear a lot about oxygen cylinder supplies, and I hear a lot about lack of beds, and I know the ICUs are overcrowded. So if you look at those things, what are some of the top things Delhi is facing today?
So the first and the foremost thing Delhi requires is oxygen, oxygen in any form. Oxygen cylinders, anything which can help reach oxygen to patients is required. the oxygen itself is a requirement, oxygen cylinders is a requirement, oxygen tanks which deliver oxygen to the cylinders is a requirement. Virtually each and everything which is associated with oxygen infrastructure is in shortfall. It's everywhere. Like suppose Delhi was supposed to have 200,000 cylinders, and the requirement right now is about 10,000, is about 100, is about 1,000 cylinders. It's a million cylinders. So no, there is no way we can make up that sort of numbers. So it's in great shortfall, and it will continue to be in shortfall for next couple of months.
Okay, great. So Priyanjali, I just want to bring you on the stage today. I know we had a long conversation about what are all the things India is facing today, and you're in your own ecosystem. You had a huge list of things you wish would be done differently, and you wanted help. You're screaming for help. So give us a little recount of the situation where you are right now. What are the services you give, and what are you facing right now?
Sure. Thanks, Vida. So starting with where we are right now, we are in New Delhi, and our core work at Aaroogya Foundation is to ensure early detection of common cancers like breast, cervical, and oral cancer in women who comes from little less privileged backgrounds, so to say. And we do it by developing artificial intelligence assisted mobile application that we give to the frontline healthcare workers like ASHA and ANM in India, and now launching in a country in Africa, that is Uganda, to the village healthcare workers so that they can go door to door and screen women and mobilize the serious patients on the spot to the nearby healthcare facility as soon as possible. So while this, huge problem where WHO last year released saying that a statistics which was horrifying, that 130 million Indians might have cancer by 2030. And we started addressing this large problem to solve it at scale. We were hit by a very acute pandemic, which practically took off everything from its, pinnacle. Like COVID-19 shook the entire nation already with its first wave with the world in March 2020. And while the entire population was trying to settle down and thinking, rejoicing that, okay, now the vaccination drive has started here in India, a lot of people are getting vaccinated at a good pace, and the virus is looking very vulnerable and non lethal, so to say. So we can all go out and relax. But last 1 week, especially, actually last 2 weeks, that Dhruv has been emphasizing a lot, and he was being very paranoid. And I was like, even I wasn't aware of the grave situation we were going to arrive at. But COVID-19's triple mutant, which is the new strain, came in from affecting only Maharashtra to Delhi, and now to almost the entire country at a very high rate. We are standing at a position where I would call it a humanitarian crisis. It almost feels like outside people are dying more on roads in the search of oxygen and basic healthcare support, because there is literally one doctor for more than 100 patients in government hospitals, even in private now, because we do not have enough skilled staff in India anyway. So it is practically impossible to support treatment and avail infrastructure to such a magnitude at which COVID has hit us again. And the second problem is that population of India uh, you know, uh, did do some negligencies where they were being very uh, easy about the whole situation. But the government also did not do very well. We had ample time to at least think proactively. which has always happened in healthcare, not only in India, I see it in other countries also, that we always wait for a phenomena to happen and then we think in hindsight and say that, oh, maybe, if we had this, then we could have saved X number of lives more. But even if we couldn't have anticipated this level of crisis, I'm sure something better could have been done, which did not happen at all. The situation, the improvement in healthcare infrastructure in India from last year to today is nil. So the problem is twofold.
Right. So this, so a lot of new things, you talked about. So the first thing is, you said that this triple mutant, and the second thing you mentioned, which is standing out, is nothing has changed from the last year in the infrastructure wise, and this thing in the last 10 days, it has taken you by surprise. So tell me a little bit more about this triple mutant. I mean, Dhruv, Dr. Dhruv or Priyanjali, both, and if you can take the question, what is different about the triple mutant? Why is it so contagious, or how is it different from the other strain which came last year? And will the vaccines prepared for the last strain, will it work for the new strain, the new triple mutant? Is it going to work at all? Yeah,
I'll take that.
sure.
When we had started in March last year, we had our first COVID variant. It was the novel coronavirus which we had seen everywhere. Then
Right.
we had a sort of mutation that was South African mutation, a Brazilian mutation, and a British mutation, which had happened. Now, what we have come across in India is a double mutant, which is which there are two types of viruses which are affecting a person at once, and they are either a combination of all these viruses or a combination of these viruses with a new virus which is an Indian mutant.
Right.
Which is an Indian mutant. So this is the triple mutant which has come up in India, and there's a fourth mutant which is there in eastern India, which has an escape mechanism. It is escaping the immune systems, especially in West Bengal and Odisha, in eastern parts of India. And I'm still to find out about what sort of symptoms does it show. But the triple mutant is showing some sort of very frantic symptoms. It's like person is seemingly okay for first 2 days, 3 days. They develop very high grade fever. Then there is sudden drop of oxygen in them. And by the time people realize that they are positive, they are COVID positive, their oxygen levels are below 80. Ideally it should be maintained somewhere above 95, and they are below 80, and it's almost too late for them to reach to the hospitals. And with the current scenario, that with each and every bed being used by a COVID patient, the new patients which are coming up every day, they are going to find it very, very hard to survive, because you cannot move a patient from their bed just because a new patient is coming. So it's going to be really, really bad in that sense. And the one more thing about triple mutant was that this type of mutation was actually discovered in India in November, precisely on 20th November last year. And a lot of money, and rather than money being spent on research of this mutant and what sort of effects it can have on human body, the whole of the money was actually used for vaccination, for vaccine purposes.
I
It
see.
was diverted to vaccine. It was diverted to vaccine. So virtually we have no information of what is coming. We only know what is happening to the patients. We don't have any scientific data. We only have objective data which we receive from our patients in the form of symptoms, in the form of what history they give. There is no scientific data for it as of now. And second most important thing is that this mutant is a little different from the other ones, the earlier ones, because the oxygen demand of the body, it increases drastically. And the amount of oxygen which is being used by a person who is serious with COVID disease is 5 times more than a patient who is in ICU and suffering from a cardiac disease.
Oh gosh.
So virtually one person is actually absorbing oxygen for 5 persons in a single day.
Oh
So
gosh.
that is something which is very, very new. And this is what is creating a lot of trouble for people. And uh, you know just to pinpoint the how scarce oxygen is right now, is that two I would quote two instances. One happened yesterday and one happened today morning. Yesterday, a tank full of oxygen cylinders was
Right.
going on a highway, and was going on a highway, and it was looted by general public,
Wow.
because they wanted it for their loved ones. And I don't fault them for it, because everyone requires it, and by hook or by crook everyone wants it. And
So,
the second
mhm,
incident which has happened today is in the capital of India, in Delhi. Is a multi-specialty hospital ran out of oxygen,
right.
and 25 critical patients died, just by suffocation, because they were not delivered oxygen. Today morning, this has happened today morning in India.
Right. So Dhruv, you gave me so many instances about, the oxygen supply chain. I want to dig deeper into that. But before that, Priyanjali, do you have any thoughts about what Dr. Dhruv just mentioned about how the situation has deteriorated about oxygen supply, and why is it that they did not anticipate this, and what are the other cities and government, and there are so many sectors which can come through the corporate social responsibility and the United Nations. Well, the US government can send in help,
Yeah,
because we got vaccines from and I mean many countries got vaccines from India.
yeah.
So what is all this doing in this supply chain deficit? Are they sitting through it? I'm curious what's going on there.
So especially Delhi, if you must have noticed, is facing this acute shortage of oxygen, because Delhi do not fall under the category of having its own industries. It's a fairly government oriented place. So there's a what I see it as is that there's not enough supply in the vicinity, and the states who can provide us are a little far. So everyone is doing their best to send in oxygen supply as fast as possible by road, and they are even trying it by air. But I think there is a lot of political discrepancies between central and state government, which is leading to many friction and hence a lot of delay. So there was a meeting yesterday regarding the same, where the chief minister of Delhi was stating all the problems to Prime Minister of India, and telling him about how the trucks and all those vehicles who are carrying oxygen are being stopped on the way for inquiry and all that. So all these things was causing delay, and what could have been done better in a national emergency is involving military, army, armed forces in this, to deploy and to make the logistics smoother. Because if there is armed forces involved, a lot of logistical issues gets very, very smooth, and the local police of every state can work better. They will have much more hands and brains to work faster. So involving them would have been really it's already too late. Each day passing by is critically losing a lot of lives, resources, and everything.
Vida, can I come in on that once?
Sure, go ahead.
Yeah. So, Vida, actually, the thing is that first thing is that the last when the last COVID wave came, there was not such a high requirement of oxygen. So so the anticipation, the policymakers and the governments, they lost out on the anticipation of the disease. That was one
Right.
thing. Yeah.
Right.
Then the second thing was the sheer pace of it. That the sheer pace of infection this time around has been baffling. It's almost like we are doctors, and we are working on ground. Even we could not imagine the sheer pace of infection. You are getting it. And with the sheer pace of infection, the policy making was not of the same. It was outpaced. every other thing has been outpaced by pandemic this time around. In case of Delhi, we have a peculiar problem that it is a political residential area. It's not an industrial area. Because it is not an industrial area, we don't have oxygen plants or any industries which can deliver oxygen. It is being delivered by far off industries, but it is taking time to reach there. There is policy paralysis. It is being taken care of, but I think it's a little too late. We are a week late in our policy making from what I can make out of it. And third thing is, the lockdown. The lockdown happened last week on Monday, and it should have happened about 20 days back. Because India suffered very badly from last COVID trade, and the economy was suffering. They were very scared of lockdowns, and because they were scared of lockdowns, they did not put a lockdown at the right time. Hence, the infection has spread at a very rapid pace, and it has outpaced every other thing which is there. As far as military is concerned, military is already there. It's they are already airlifting a lot of oxygen from foreign countries. Singapore has come to India's rescue. Then Israel has come to India's rescue. Of late, Japan and Australia have come to India's rescue. But the sheer pace of it, before people could realize that this has happened, uh, generally, last time around the pace was much slower than this, and the speed of policy could actually offset the pace of the pandemic. But this time around, it's just too fast. So I would put a fault on our policymakers and also on the pace of the pandemic this time around.
So this is a great insight, Dhruv. You mentioned so many countries who are helping us. That is heartening to know, because India was there for them, and they have returned the favor. So that is great. Now there are two things I can see here. It is in a management term, it's called complex, complicated, and then chaotic. So it's gotten from complex situations suddenly to chaotic. Now, in chaotic situations, military and strong one-sided thinking is required. So, for example, if you just mentioned when the funds were not diverted to variant research back then, when the new variants were going to come, that is somebody who has a lot of subject matter expertise. People should listen to them. So those should be the words which should be actually implemented. Now, similarly, then we need some sort of leadership. Everybody should listen to them and follow their advice. So I mean, fortunately or unfortunately, I get wedding photos from India at this time. People are having birthday parties. I know there are 15 people or 10 people, whatever, but aren't these events super spreaders? These, even though they're doing it in their house, and I know that the election commission has a limit of 500 in the campaign. 500 people can meet for the election campaign. Isn't that something which is not logical at this point? How can 15 people meet for a wedding, or how can people meet for an election campaign when all this is going on? Does that even make sense?
So, Vida, I would like to comment on this. The first scenario, in terms of wedding ceremony, it's upon the basic common sense of a human being to call it off, right? I mean, there is no logic to support this fact that someone is really doing an activity like that at this point where the country is actually in the greatest state of emergency it has ever seen, because the entire enmity against which we are fighting is invisible. And the second fold of your question, which it talks about election rallies, if the leaders of the country do this, then what will others think of, like
Why can't you keep the leadership going? Whatever leadership is there, let them get through the pandemic and then host elections. Who has made the rule that every 5 years elections should happen? When
exactly.
when people are not alive to vote, right? What are you going to
Exactly.
do with the election, right?
Who will you govern upon? I think they have taken the entire democracy of India statement too seriously, that it is all by the people and for the people and of the people. They have left it on people to do whatever they want to do. So it's a failure of leadership. It's a failure of healthcare infrastructure that has not grown over decades. It is a failure of citizens and their common sense. Yeah. But the problem is, outpacing the magnitude of everyone's failure. It is just increasing exponentially every day, outpacing every possibility of handling it in any way. So, it's two-sided.
Right. So along those lines, what can we do? Pick up from how the Southeast Asian countries manage SARS, or these kind of regular infectious pandemics, or we have several instances of this repeating cyclically across time, especially in Southeast Asia. So what are they doing differently? I know Israel is mask free now, but Israel is a small country. Can we think like a small country in small regions and contain, like Delhi, if you treat it like a country, what can you do differently?
Vida, that's the problem with Delhi, especially the way it is geographically located. We cannot treat it as a small country because there's so much influx and outflux for everything, on a day-to-day basis, that uh, if we stop that to treat it as a confined country, we are basically stopping the logistics and economy of a lot of other, surrounding states. So that's a very difficult situation to put Delhi in and the surrounding states. So the reason why the other infections were getting controlled was because there was some sense of education and protocol which has been followed for basic bacterial or viral infections over time, standard protocols that has been followed by doctors in the world, and uh, test and trial, A/B testing, like we say in marketing. People do that and they arrive at something that is working, right? But in this case, nothing is working. It's outpacing every human, effort. So um, logically, I think if people just concentrate on how do they get vaccinated, just single point direction, and if leaders concentrate on how to accelerate vaccination, even if someone is coming for testing or someone is coming to buy medicine, if we can convert every center, whatever existing operations is happening in micro facilities, into a COVID vaccination center, it might work, because at least the pace will pick up.
Right, right. So
Uh,
Dr. Dhruv, yeah, you had something to say.
Vida, I had something to say about this. The first and foremost thing, is the human nature. We need to control ourselves. The basics of controlling a pandemic is our, social distancing and masks. Until unless you don't do that, be it any vaccine, be it any policy, it won't work. It won't work.
Right.
People, I have seen pictures of the weddings where, people of 250 gathering of 250 or 500, they were there with hardly anyone having any masks. You cannot, nothing can, if the common sense does not prevail, no policy, no vaccine, nothing will work. One thing is that. Second thing is that I have seen and I have heard people who have been vaccinated and they have taken away their masks and they said that since I am vaccinated, I will not be able to infect or I will not get the infection. I have actually heard this from people, and this, it's atrocious to say, but they have been doctors. So it's very difficult. It's very difficult to inculcate these basic things in people. But if the basic things continue, then I think we will have a control over this quickly.
Right. So, why do people who are vaccinated still have to wear a mask? Because this mask thing, it's become a big joke because they wear a mask, it's below the nose. And
Exactly.
I saw a lot of these video footages of people standing outside the hospital with a COVID patient, and the COVID patient does not have a mask. So basically, in that crowded hospital queue, the COVID patient is become a super transmitter. So anyway, now yeah, I was wondering what your thoughts are on this mask, and why do you think people who are vaccinated cannot spread, or they can become a carrier? What are your thoughts on that?
Uh, uh, Vidha, we have to understand that the vaccines which are coming out right now, they are for emergency use. Now, there is a difference between regular use and emergency use. Yes, let's take an example of the polio vaccine. The polio vaccine was made over a period of 20-25 years with a lot of research.
Right.
And we have made COVID vaccine with a research of 6 months or 7 months or maybe 8 months or a year at max. We still don't have the long-term data of these vaccines.
Right.
So there is a question about the efficacy of these vaccines and how effective they are over the period of time. No matter whoever says that it has 100% efficacy or 90% efficacy, but the long-term effects of these vaccines are still not there because the pandemic itself is only a year old.
Right.
One thing is that. Second thing is that the mutants. Each time a new mutant comes, your vaccine has to be upgraded. Just like the influenza vaccine in US is upgraded almost every second year because you have a new variant of influenza every second year.
Yes.
Something of that sort has to happen with the COVID vaccine also. So the fact that vaccines might not be sufficient, but they might be sufficient for you to not get serious enough to reach a hospital. You might fall ill, but you might not require hospitalization. This is something which I have understood from it. But
I see.
but that does not mean that you will not be infectious. You will not spread infection. You
Right.
have to be cautious of that fact.
Right. So amazing. So we have some attendees here joining us. I'd like to invite attendees to, unmute their mic. And if you have any questions, you can ask a question. So we have Dr. Priyanjali Datta and Dr. Dhruv Kacker from Aaroogya Foundation. They are specializing in telemedicine facilities. They are also helping enable COVID supplies. So if you have any questions, you can bring it up here. So Priyanjali, are you seeing any questions on YouTube or?
Yeah, just checking it. Like I'm going on YouTube and checking.
Okay, never mind. So if you have any questions, you can ask the question. So we have Dr. Priyanjali Datta and Dr. Dhruv Kacker from Aaroogya Foundation. They are specializing in telemedicine facilities. They are also helping enable COVID supplies. So if you have any questions, you can bring it up here. There's some sort of an echo. So never mind. All right. So great. I want to ask Priyanjali, is this a good time we flash your request? We can flash your request.
Yeah.
So if you might have any questions, you can ask the question. So we have Dr. Priyanjali Datta and Dr. Dhruv Kacker from Aaroogya Foundation. They are specializing in telemedicine facilities. They are also helping enable COVID supplies. So if you have any questions, you can bring it up here. There's some sort of an echo. So never mind. All right. So great. I want to ask Priyanjali, is this a good time we flash your request?
Sure.
We can flash it. Never mind.
Yeah.
So if you might have any questions, you can ask the questions. So we have Dr. Priyanjali Datta and Dr. Dhruv Kacker from Aaroogya Foundation. They are specializing in telemedicine facilities. They are also helping enable COVID supplies. So if you have any questions, you can bring it up here. There's some sort of an echo. So never mind. All right. So great. I want to ask Priyanjali, is this a good time we flash your request?
Sure.
We can flash it. Never mind.
Yeah.
So if you might have any questions, you can ask the questions. So we have Dr. Priyanjali Datta and Dr. Dhruv Kacker from Aaroogya Foundation. They are specializing in telemedicine facilities. They are also helping enable COVID supplies. Okay. So Priyanjali, do you want to read out the donation options?
Sure. Sure. So thank you everyone who have joined us, Abhishek, Dr. Savarna, everyone who has joined us and who's watching us today. We are based in Delhi and we are an organization called Aaroogya International working in the space of screening women in the underprivileged section of India and Uganda for common cancers like breast, cervical and oral cancer. And during pandemic, we are facilitating some basic facilities to COVID patients and their families, like teleconsultation, COVID home care, counseling, and supply chain information dissemination, etc. If you donate $5 or 350 rupees INR, we can help one more COVID patient have one teleconsultation with a doctor from their comfort of home. If you donate $100, we can give complete 2 weeks, home care, counseling, and teleconsultation to a COVID patient. If you donate $50, we can do the screening of 10 women for breast, oral, and cervical cancer in Maharashtra. So if you want to donate in Indian currency and you are in India, or you have an Indian bank account from which you want to donate, you can go on the UPI handle. The link has been provided by Vida here on the slide, or type the UPI handle of Aaroogya Foundation 8383820651 at paytm. And if you want to donate in US dollars, please contact me on my email ID at drpriyanjali@aaroogya.org.in, and I will help you and facilitate you with the process.
Yeah, thank you. Thank you, everyone. I think we have another new attendee coming here. We have a new attendee. Okay, sorry about that. Somebody just tried to join. Okay, thank you, Priyanjali. I really appreciate you sharing the details here. I will try and share this message on social media over the next week. I know we did this on a very short notice, but one of the last things, before we hop on to another topic, is what is your day like? What is your day like in Aaroogya International? You're based in Delhi. You're working with a consortium of people who are catering to the COVID-19 situation. You're helping frontline workers. What's your day like?
Vida, our day looks like never ending. It's round the clock work. And especially after March 2020, we have been missing out on the daily schedule, a regular schedule for ourselves. But I think that's with a lot of people who's working and fighting at the front end, be it healthcare workers, be it IT professionals, scientists, government policymakers. Everyone is just working around the clock against this humongous problem upon humanity. So yeah, praying so that we all can sail through.
Right. Thank you. It's heartening, and I hope that this pandemic will come to a close soon. So as I was talking to you, I saw this news flash in Delhi. It seems they have sent oxygen supply to Delhi based on Kejriwal's request. So things are not so bad. India is scrambling and figuring out how to meet the demands. So, Dr. Dhruv, what is it like for you? What is your day like? What do you spend your time on, and where do you see the challenges?
An ideal day would have been going to our office and working there, and figuring out stuff, figuring out how to work on ground, how to look to the for the women. We actually screen people for breast cancer, oral cancer, and cervical cancer. But past 1 year, we have been out of our offices. We have been working from our homes. We have been. It's been a while since I have seen figures in 3D. I have been seeing figures only in 2D because I'm always working on laptop, and something of that sort. And past 20 days have been really, really hectic. I have been continuously on phone, on WhatsApp. We are receiving help, SOS messages from people, SOS calls from people. And whatever means and whatever sources we have, whatever contacts we have, we are trying to address whatever little we can do about it.
So what kind of SOS calls do you get? I know oxygen cylinders, beds, they're the top requests.
Oxygen cylinders, this is something very interesting. So a pandemic is going on, and other pandemic is actually brewing on. That is about the other diseases. It's been a year. And everything has been about COVID. People have there are diabetic people, there are patients, there are heart patients, then there are people who are suffering from kidney ailments or liver ailments or cancer. Right. These are the people who have not received proper healthcare in past 1 year, and past 2 months have been horrible for them.
Right.
So, so suddenly, we are receiving a lot of SOS messages from these people also, because they want to actually access healthcare, which is non-COVID. you know
Mm.
so we are also trying to help them, at this moment, like my father is a surgeon. He's a general surgeon, and he's a renowned specialist in Delhi. And I receive a lot of calls from people, who had some sort of a gastro issue or a stomach issue or liver issues, which they wanted to show but they are unable to show because of COVID. So we are
Right.
also trying to take care of those sort of SOS messages.
Right. Right. And rightly said. How are you supporting the families of people who have lost someone, kith and kin, due to COVID? You may be getting counseling calls, or uh, even cancer patients, their families need support. They need teleconsultation. They need supplies. I think, I don't know how you're managing. Probably you have a priority list, or
Mental health should be a priority, but unfortunately it is not, because of the sheer emergency which has happened right now. Because something which is happening physically is much more emergent to us, rather than something which is something which cannot be seen.
right,
So
right,
that is a third sort, that is a different pandemic which will happen in a couple of months, where a lot of people will turn up with, right now people are too scared to come out and to talk anything else but COVID. So
right,
once COVID slows down, I'm sure we will see a new pandemic with mental health issues also.
right. So this is going on in waves. It's going on in waves. So I want to close with the last question here. After that, I will share your again details of all the supplies you need help with, so that people who are watching this video later on, they can reach out to you and contribute. So I want to ask, what is your vision of how this pandemic will end, and what will happen when we are coping with the end? What's going to happen? What Any of you can take the question. How is this going to end? What is your vision? Let's say you are imagining a good nice day where nobody's wearing a mask. If you work backwards, how are you going to trace your steps?
I think if I talk about it, it is going to be about coping with the pandemic and not coping with the end of pandemic, because honestly the sheer mutation level and infectivity this virus is showing is making me believe that we do not have enough bandwidth and resources to do as fast research about it as we can. But coping up with the pandemic and the next few months and next few years looks like, uh, you know, extreme um, fearfulness between people to meet and greet each other and be in public forums or be out there on vacations. It's going to be very difficult for people to come out of that inertia of mental fear that we are developing subconsciously about it. And the other thing is that this is about the strata who will be still comfortable to live with basic means and have resources. But what really worries me is when we arrive towards the end of it, how many people will be, economically uh, holding themselves well enough to sustain through the whole process,
Yeah.
because there's so much jobs lost, there's so much migrations happening, there's so much demographic changes which is so fluid right now that we are not noticing it. But the complete change of the demography will or may result into something very positive or negative. So uh, it's a wait and watch for me.
Right. Fantastic. Amazing. I think most of it I can relate to, because in California here, the pandemic has, it's kind of died down. So I'm having fear of going mixing with people like I used to before. And so, yeah, Dr. Dhruv, what are your thoughts on that? What do you think?
So I don't see this pandemic, and that there is not a particular day or a particular year when this pandemic will end. But let's say we are still, I think about 30 months away from being mask free, about 2.5 years away from being mask free.
Right.
Yeah, especially in the Western world is about 2.5 years away, and the Eastern world maybe about 3.5 to 4 years a half away.
Right.
And generally, it is a rule of pandemic that the second wave is much more deadlier than the first wave.
Right.
It's
Right.
it's the rule of the pandemic. So I think that the country has been hit by the second wave, and the coming waves will be more of ripples than the waves itself.
Yeah.
Because I think because all the damage which could be done has been done, and I think almost everyone from every family has one COVID case right now in the country.
Yeah.
So
Yeah. That's
so
right.
so yeah, so that is something that is something which we have to consider. And as Priyanjali had said, we need to find ways, need to find means to sustain ourselves for through this tough period. Once this period is over, we will be standing on ground zero, and then we can reassess ourselves and then restart our lives. But right now, it's a little difficult.
I think it will take 2 to 3 years. If you're talking about these ripples and sub ripples, right? It's not going to end. Everything has
About
to adapt according to that. And I think you being a telehealth organization, your services will be in most demand, in the highest demand. Okay, we have a doctor logged in, but related to me. So if he has questions, we'll take it offline, I guess. So what about the I have to ask this. I am from Silicon Valley. How did the startups do in this scenario? Because startups are mavericks, they don't have rules, they pivot. And I mean, you are a telehealth startup and you did pivot, right? You did a move from breast cancer centric services to COVID logistics enablement services. What was it like? Was the startups, how did they thrive in this pandemic time? The healthcare startups, the the logistics in healthcare, the AI in healthcare, the telehealth in healthcare, the cancer diagnostics. How did they do during this COVID period, last year and a half?
Vida, we did not completely pivot as an organization. Our core offering is still the same, and it will continue to be the same. We did create another vertical and one more team where the COVID-19 pandemic well-being task force operations was handled. But other startups in India, especially if I talk about, as I've seen, have thrived in the healthcare space really fast. Their growth has amplified. The pandemic has created that extreme sense of urgency in the minds of entrepreneurs so well that people have pivoted, iterated, and tried to reach their product market fit as per the emergency. And people are doing quite well.
Yeah, they are
There's
doing
a,
quite well. Mhm.
they're doing very well, and uh, quite a lot of startups in our circle have raised good amount of funds, and they are doing well. They are creating valuable solutions for customers. So I think there was a really positive wave for startups, especially in the healthcare sector in
Seeing them
India.
Right, right.
suffering because
Right.
of the
Sorry,
illness itself.
sorry. So no, I was wondering about the plight of the hospitals as well, because they've been overwhelmed with requests. They're converting beds, and I know there were a lot of retired doctors. Their facilities small. They put pressure that you're converted into a COVID hospital. Are startups doing something to help the hospitals per se?
Uh, yes. So a lot of startups have come up with, mostly IT solutions, which is making the work a little more easy for the hospitals. Physical infrastructure, they have created really innovative, low-cost ventilators, low-cost home testing kits for COVID-19. Also now people are thinking about how to go back to our school days, think about the electrolysis process and make some kind of oxygen supply, or not the conventional one that we use in hospitals, but something that can be done with our basic childhood knowledge. So people are doing their best. Masks have come up, very good quality protective shields have come up, which is being used by doctors and other medical and paramedical healthcare workers. So uh, I won't say that completely change the entire capacity of a hospital to handle more patients, but definitely increased the efficiency by enabling low cost innovations.
Right. Awesome. So great. So I have a couple more doctors joining in at this point. I'm just going to flash the messaging for the donations, but before that, did you have any? If you have commitments, you can leave. I'll just take the calls with the doctors. Dr. Dhruv, I really value your time. I know you're busy people, and I'm so glad you came here. You made time to, take requests. So we are here with Dr. Priyanjali and Dr. Dhruv Kacker from Aaroogya Foundation. They provide telehealth services for cancer patients, and now during COVID, they are enabling frontline workers, hospitals with supplies, with teleconsultation, and also they're tied up with corporates, nonprofits, and they are helping hospitals, patients, and I'm on their social media groups. They always tell how many beds are available, which hospital. If somebody sends them an emergency message, they are giving them resources, whom to call, which bed is available, where is the closest oxygen supply. So they are doing a lot of service. So if you want to contribute to them, these are a few channels you can contribute. I think you can donate in three buckets: $5, $100, or $50, and they have payment options in INR and US dollars. I'm going to upload some of this information on the YouTube and Facebook feeds, so that you can come back and you can reach out to them. With that, yeah, we have two doctors. We have one doctor here. Any questions? Any questions here? Yeah, I know. I think if no questions are there, we can wrap up. Any last closing thoughts, Dr. Priyanjali and Dr. Dhruv, before we wrap up?
Yeah, Dhruv, go on.
Do you have any questions?
As a thought, especially to people in California who are, who might be listening to us, we still, we are still not out of it, and it will be some time before we are out of it. So please take care, and please use your masks. Please use your common sense as much as possible. Because you never know what sort of variant might come up again. And vaccinations are still not foolproof, but yeah, and just but we will get through this. Everyone does, but let's hope we get through this with with as minimal loss as possible.
Right. Thank you, Dr. Dhruv. That's a great word of caution, wisdom, and advice. And Dr. Priyanjali, last thoughts from you?
Sure, thanks, Vida. Thanks for arranging this live session for us. It's really very sweet of you to do this. And I would ask and urge our friends and supporters in California, especially, to help India at this moment. And if you are willing to know more about us, you can contact us on my email ID, drpriyanjali@aaroogya.org.in. And you can also, after this session, Vida will upload the information to donate for COVID care and cancer screenings that we do for underprivileged people in India. You can go ahead and donate to us. In INR, you can go ahead and donate to us through UPI link that has been given. And if you want to donate in US dollars, you can contact us on the same email ID. So please be safe, and we are all in this together, and we'll sail through it. Thank you so much.
Thank you so much. And Dr. Dhruv, Dr. Priyanjali, it's been a pleasure and honor having you over. And we wish you a much wellness and happiness and good luck and strength here in this pandemic. And we will come back to you to learn how to lead during the pandemic. We will definitely come back to you and learn from you, because I see a structure, a pattern, a model emerging here. Obviously, it is very different from what is existing, and only people like you can build the next generation healthcare infrastructure which will survive this, acid test or whatever it is, or however long it lasts. So a lot of ideas came out today, which I think has never been spoken about, not even on the news channel. Nobody is talking, because you're there, you're facing the problem, you have dealt with the issues, you're talking about it because you know it. So I'm sure I'll take it as far as I can with this recording, with these ideas, and with this contact. And hopefully many people will contribute to efforts of Aaroogya